السلام عليكم ورحمة الله وبركاته. Anatomy of the small intestine. Small intestine, it is like a tube, and this tube is convoluted about 6 meters in length. Extend from where the small intestine from the termination of the duodenum or from the pylorus of the stomach till the termination in the cecum. If you remember that the small intestine is starting from this is the stomach, and this is the duodenum, C shape. Then after the duodenum, it is jejunum and the ileum, and the ileum will terminate in the large intestine in the cecum. This is the cecum. So the junction between the pylorus and the duodenum. So the small intestine is starting from the pylorus. This is the beginning of the small intestine, and they terminate where at the cecum at what is called ileocecal junction or ileocecal valve. The small intestines is located in the center of the abdomen, but the large intestine in the flank or in the periphery. Small intestine three part. The first part here is the duodenum, then the jejunum, and finally the ileum. The peritoneal covering of the jejunum and the ileum have its own peritoneal covering. It's completely covered by peritoneum. And the peritoneal covering of the jejunum and the ileum is named mesentery. Very important to allow the free mobility of the small intestine and fixed by the mesentery to the posterior abdominal wall. What are the difference between the jejunum and the ileum? The jejunum and the ileum about 6 meters in length. So we'll divide it into according to the length. The jejunum about 2/5, but the ileum it is the distal 3/5. يعني the jejunum after the duodenum direct, and it is shorter than the ileum. The ileum it is a distal part of the small intestine. The wall of the jejunum is wide, but the wall of the ileum is narrow. طيب. What means by arcades? Arcades. The jejunum and the ileum or the small intestine, it is a part of the midgut. Midgut. Embryology اللي هو المidgut. And the artery of the midgut is SEMA, superior mesenteric artery. And the superior mesenteric artery to supply the jejunum and the ileum, this is the superior mesenteric artery, the SEMA. And this is the jejunum. Here also the SEMA, superior mesenteric artery. And this is the ileum. طيب. The superior mesenteric artery give branches to supply the jejunum and the ileum. The branches in the form of what is called arcades. This is the arcades. And after that, we'll give artery named vasa recta. So this straight artery is اسمه vasa recta. And this branches بنسميها arcades. Arches يعني. Like arches. Arcades. And in between the arcades here, this space is named windows. Window. طيب. Here the SEMA supply the ileum in the same way, but the shape is different. The arcades is more here. The arcades is more. And this is a vasa recta. So what are the difference between the arcades of the ileum and the arcades of the jejunum? The arcades of the ileum of the jejunum is few, yes, or less, or simple. But the arcades of the ileum, yes, is more complex, more numerous, more short. طيب. What about the vasa recta? Vasa recta. The vasa recta in the jejunum is long. The vasa recta of the ileum is short. طيب what about the windows? Windows. The windows here in the jejunum is visible. يبقى الويندوز visible. يعني you can see because the arcade is less. But here the windows here is hidden. So is invisible. يبقى الويندوز in the ileum is invisible. This is the main difference, and it is very important surgically how to differentiate during the operation between the jejunum and the ileum during the operation. Just we hold what is called the mesentery, the yellow color here, the mesentery, and stretch it, and you will see the windows and so on. Right. So here also the jejunum few fat, but the ileum more fat. Windows visible, the windows invisible. طيب, this is if you open the jejunum from inside, this is what is named circular fold or mucosal fold. The fold here is more numerous, but the ileum is less or few. And the wall of the jejunum is thick, but the wall of the ileum is thin. طيب, what means by Peyer's patch? Peyer's patch is a lymph node. It is, if you see under the histology, or you can see a patch, and this patch اسمها patch يعني collection of what is called lymph node. If you see this lymph node patch, it is named Peyer's patch. Very, very characteristic for the ileum and absent in the jejunum. اسمها Peyer's patch. One of the most characteristic difference between the jejunum and ileum, this patch. طيب, we can shift to mesentery. What means by mesentery? We discussed before that any peritoneal fold you want to discuss, you have to fulfill three items. Number one, what is the definition of the mesentery? Number two, the attachment of the mesentery, attached to what? Number three, what are the content of the mesentery? The content. يبقى we have to fulfill three items. Okay, we can remember what means by definition of the mesentery. Any peritoneum, you have to mention first it is a peritoneal fold, and then choose which organ, peritoneal fold of which organ. Mesentery, it is a peritoneal fold of the jejunum and ileum, or small intestine. Jejunum and ileum. طيب, what are the attachment of the mesentery? Attached to what? And what is the content of the mesentery? What are the content of the mesentery? Okay. We can make, if you remember, this is the duodenum. We have four parts of the duodenum. And this is the jejunum and ileum. And will terminate in the cecum. This is the cecum. And this is the ascending colon. طيب, number one. What are the connection between the duodenum and the jejunum? This connection أو junction هنسميه duodenojejunal junction. Duodenojejunal junction. طيب, this is the ileum and this is the cecum. So what is the name of this junction? Iliocecal junction. So the mesentery, it is a cover. Cover of what? Cover of the small intestine, jejunum and ileum. So this cover have two border. One border is named attached border أو بنسميه posterior border or a root of mesentery. All have the same name. So we have attached border, posterior border, or the root of the mesentery. This border from where to where is attached from اسمه attached from the beginning of the jejunum and ileum اللي هو duodenojejunal junction till the termination of the ileum at the ileocecal junction. This is the attached border. This is the attached border. This is the attached border. And is 6 inch in length. And is crossing in front of the third part of the duodenum. You have to mention. يعني this root or this border or this posterior border of the mesentery crossing in front of the third part of the duodenum. يبقى what is the name of this هنا root of mesentery. طيب. After that we have here what is called the free border. The free border go from the attached border and cover the small intestine and return it back like that. Like a cover. So what is the name of this هنا border بنسميه الفري border أو or anterior border about 6 meter in length, the same length of the small intestine. يبقى الميزنتري have to border. This is the attachment. This is the peritoneal fold of the jejunum and ileum have to border one was posterior or the root from the duodenojejunal till the ileocecal and the 6 inch in length, and the free border encircle the small intestine or enclose the small intestine and the 6 meter in length like a fan shape. Fan shape. طيب, what are the content of mesentery? What are the content of the mesentery? This cover contain what? Please, any peritoneal fold contain the content will be sympathetic and lymph and fat. And we can add the organ of this fold plus the blood supply of this fold. يعني if I tell you what is the name of the mesentery peritoneal fold of the small intestine, طب what is the content of the mesentery? You have to mention sympathetic, lymphatics, and the fatty tissue plus the organ. What is the organ inside this peritoneal fold اللي هو الميزنتري? Small intestine. يبقى contain the small intestine in the free border. What else? What is the blood supply of the small intestine? If you remember, we have here in the root of the mesentery sama and semav, superior mesenteric artery and superior mesenteric vein. So superior mesenteric vein and artery. Vein and artery. So what are the content again of the mesentery? Small intestine in the free border and the superior mesenteric vessels in the attached border and the sympathetic, lymphatic, and the extraperitoneal tissue. So we have to differentiate between the content and the attachment. So the mesentery have to border هنا like that. This is the root of the mesentery or attached border contain sama. This is a sama, and in front هنا this is the duodenojejunal junction. This is the ileocecal junction. This is the small intestine. The yellow color here is the mesentery, and this is the jejunal branches or the blood supply to the jejunum and ileum inside, 6 meter in length. Structure in front هنا the ulnar root of the mesentery in front of the third part of the duodenum and the inner structure behind it. If you remember the structure behind the duodenum third part اللي هو 6 structure aorta, IVC, psoas major, ureter, gonadal and so on. So the attached border in front of all these structures. What are the content of the mesentery? I told you in the attached border, superior mesenteric vessel. In the free border, a small intestine. Plus we have lymph node, sympathetic, and fatty tissue. طيب, we can shift to what is called SAMA, superior mesenteric artery. Superior mesenteric artery. بنسميه الارتري of the midgut. Any artery, foregut, midgut, hindgut. The foregut is celiac, midgut is sama, superior mesenteric, hindgut is ima, inferior mesenteric. All these arteries arise from where? From abdominal aorta, from the front of the abdominal aorta. And you have to choose the level. Celiac from L1 at the upper border, but here Sama from the lower border of L1. lower border of L1. طيب this artery اهو سما اهو شايفين الاورطه. This is the aorta. This is the celiac. This is the sema superior mesenteric, and this is the ema inferior mesenteric. شايفين الاورطه between the aorta and the sema. There is a vein in between, lodged in between sema and the aorta. أهو between sema and aorta we have a vein. What is the name of this vein? From the kidney, from the left kidney, اسمه left renal vein. So the left renal vein in some patient may be compressed between these arteries, and the patient will complain from the pain and hematuria. Very important clinically. The patient came to your clinic with a pain and hematuria, and after you full investigations, you no detection of anything. You just ask the patient to make angiography. You will see that this vein compressed between these two arteries. What is the name of this syndrome? بنسميها nutcracker syndrome. Nutcracker syndrome, it is a syndrome due to the compression of the left renal vein between the two arteries اللي هو the aorta and superior mesenteric artery. طيب what are the midgut? What are the midgut؟ تعال نشوف كده مع بعض. And this is the duodenum. And this is the head of the pancreas. And this is the jejunum and the ileum. So this is a small intestine. طيب where the large intestine starting from the cecum, and this is the cecum, and this is appendix, and ascending colon, and the transverse colon, right to third of transverse colon, right to third of transverse colon. If you I ask you about what are the derivatives of the midgut, you have to tell the remaining part of the duodenum, the jejunum, and the ileum, and the cecum, appendix, ascending colon, and the right two-third of transverse colon. All these are midgut, so this sema superior mesenteric will supply all these arteries. Sorry, all these organs. طيب from where the sema? From the front of abdominal aorta, descending in front of the third part of the duodenum, and curve to the right until reaching the ileocecal junction. This is the artery named, what is the name of this artery? Sema, superior mesenteric artery. اهو نازل in front of the duodenum and curves to the right till the ileocecal junction. طيب what are the branches from Sema? What are the supply of Sema? Supply what? Number one will supply the remaining part of the duodenum and the head of the pancreas. This artery named inferior pancreatico duodenal. Between the duodenum and the pancreas will give the first artery اسمه inferior pancreatico duodenal. After that will supply the jejunum and the ileum. So we'll give jejunal branch and ileal branch اللي هو الارcades. If you remember, jejunal branch to the jejunum and the ileal branch to the ileum. So supply now mostly the all of the small intestine. طيب shift to the supply to the large intestine. Will give artery to the ascending colon. What is the name of this artery? Right colic. Right colic. Right colic. This artery supply the ascending colon and will give branch up and branch down to supply all the ascending colon, and also supply the part after the ascending اسمه right colic flexure and before the cecum. يعني so the right colic artery, it is the main artery of the ascending, and also can supply the right colic flexure and also can supply the cecum. What else? Will give to the transverse colon right to third artery, and this artery supply right to third of transverse colon and the flexure اسمه middle colic. Middle colic. Middle colic. all this artery will anastomose together. اهو يعني ديك ارتري كده اسمه رايت كوليك and this right colic هنا supply all the ascending and cecum and also right colic flexure will give also artery to the transverse colon ها to supply the transverse colon and also the right colic flexure اسمه middle colic. طيب what else? The terminal part of the superior mesenteric artery named ileocecal أو ileocolic. Cecal or ileocolic. كلمة ileo يعني give a branch to the terminal part of the ileum. أو ileocecal or ileocolic will give the terminal part of the ileum and also will give a branch to the appendix, supply appendix اسمه appendicular artery and also supply the cecum اسمه cecal arteries to cecal anterior and posterior and also supply the ascending colon. And all these artery anastomose together. كل الارترز دي will anastomosing together. So what are the branches of the SAMA? Inferior pancreaticoduodenal, jejunal branch, iliac branch, to the colon يبقى right colic, to the transverse colon middle colic, to the cecum appendix and ileum اسمه ileocecal or ileocolic. Oh, this is the branches of the SAMA, inferior pancreaticoduodenal. This is number one. Number two, jejunal and iliac branches. بعد كده يديني رايت كوليك على الرايت كوليك اهو. Give branch up and down to supply ascending colon right colic. Supply branch to the transverse colon right to third اسمه middle colic. Not all the transverse colon, the right to third. Right to third of transverse colon. and also بيجيب برانش اسمه اليوسيكال اور اليوكوليك سبلاي طبعا الاليوم سيكم اه اليوم اسمه اليو يبقى اليوم وسيكال يعني سيكم and appendix appendicular. These are the branches of the SAMA superior mesenteric. If I ask you what are the blood supply of ascending colon, you can say SAMA superior mesenteric artery, or you can say right colic of SEMA, right colic of superior mesenteric artery. What are the arterial supply of the cecum? ممكن تقول cecal branches of ileocolic and in between brackets from SEMA. All these arteries from SEMA اللي هو الميد gut. What are the arterial supply of the transverse colon? The transverse colon, it is the connection between الميد gut and the head gut. So the transverse colon have two supply. SEMA the right two third and EMA the lateral one third. So the transverse colon have double blood supply. SEMA and EMA. شكرا جزيلا.